Quercetin is used for allergies, arthritis pain, athletic muscle soreness, memory, a leaky gut, and reducing the symptoms of COVID-19. Quercetin is a flavonol from the flavonoid group of polyphenols. Quercetin is commonly found in foods like capers, buckwheat, radish leaves, dill, cilantro, onions, and many others. Quercetin is also found in some herbal supplements like ginkgo biloba and St. John's wort. As one of the most abundantly consumed flavonoids in your diet, it's estimated that an average person consumes up to 30 milligrams of quercetin per day. Quercetin's unique biological properties can improve cognitive and physical performance, and it can reduce the risk of infection. The antioxidant properties of quercetin can help to fight free radicals, reducing the cellular damage caused by oxidative stress. It can reduce blood pressure, boost immunity, fight inflammation, combat allergies, prevent infections, and help to repair a leaky gut and a leaky brain. Quercetin can lower the risk of age-related cognitive decline and neurodegenerative disease. As a potent antioxidant, quercetin has been shown to inhibit the amyloid plaque that's associated with Alzheimer's disease. Quercetin improves memory by boosting mitochondrial function and decreasing reactive oxygen species production. Quercetin protects against brain toxicity caused by heavy metals like lead, metal mercury, and tungsten. Quercetin is known for its anti-inflammatory properties. It's used to lower blood pressure, to control obesity, to lower cholesterol, and to protect against heart attacks and stroke. Quercetin is yellow in colour and is poorly soluble in hot or cold water, but easily soluble in alcohol and fat. Quercetin cannot be produced in your body and must be obtained from food or as a supplement. It can be found in many fruit and veg, like buckwheat, nuts, flowers, broccoli, olive oil, onions, grapes, etc. It's one of the popularly used bioflavonoids for the treatment of metabolic and inflammatory disorders. Hundreds of in vitro and animal studies and a few human studies have been conducted on the effects of quercetin. Research shows its antioxidant properties are potent enough to treat infections, inflammation, neurodegeneration, and even certain types of cancer. It's also recently been found to be beneficial in reducing the symptoms of COVID-19. A Chinese study showed that the quercetin bound with the spike protein in the coronavirus, reducing its ability to infect the cells. Several in vitro studies show that quercetin is a potent antioxidant and it's capable of scavenging for free radicals and protecting the brain from damage that's caused by oxidative stress. Quercetin's antioxidant property is mainly due to its effect on glutathione, enzymatic activity, and reactive oxygen species caused by environmental factors and other toxins. Due to its ability to scavenge free radicals, quercetin has the potential to reverse cognitive deficits and to improve memory. One animal study using mice showed increased learning and memory in the mice who were administered quercetin, with no improvement in the control animals. Natural brain aging often results in neurodegenerative diseases like Alzheimer's, Parkinson's, and Huntington's disease. But even if you don't experience neurodegenerative diseases as you get older, human aging naturally results in chronic inflammation, poor memory, increased belly fat, mitochondrial insufficiency and dysfunction, neurodegeneration, high cholesterol and triglycerides, and insulin resistance. Adding quercetin to your diet can help to prevent neurodegenerative diseases and the symptoms typically associated with aging. Quercetin has the unique ability to increase Claudin-4, which seals tight junctions and heals a leaky gut or leaky blood-brain barrier. Quercetin is a potent antioxidant and it can protect your brain from oxidative stress. In 2014, scientists administered quercetin to rats within 48 hours of the animals suffering from a brain edema. The study showed a high dose of quercetin administered 48 hours after the stroke helped to reverse the neurobehavioral deficits that were the result of the brain edema, the swelling due to the fluid buildup, including a significant reduction in the oxidative stress and a reduction in cellular apoptosis. Quercetin protects the brain against toxins by activating the brain's natural immune system. Another study in 2013 was conducted to deduce the effects of quercetin on lead toxicity, and it showed that the quercetin significantly prevented lead-induced neurotoxicity and oxidative stress. Studies with animals also demonstrated quercetin's ability to help to preserve brain activity in degenerative diseases like Parkinson's and Alzheimer's. 3 studies show that quercetin has therapeutic potential because it can inhibit amyloid beta aggregation and tau phosphorylation, and it inhibits acetylcholinesterase, which in turn increases the neurotransmitter acetylcholine. Quercetin can also boost testosterone levels. UGT2B17 is an enzyme and it converts testosterone into testosterone glucuronide. This is then excreted out of the body through the urine. Quercetin has been shown to inhibit the activity of this enzyme by as much as 72% according to lab studies. This means supplementing with quercetin as a nootropic may slow down the excretion of the testosterone byproduct, and it can boost the levels of testosterone in your blood. Quercetin also inhibits aromatase, which is an enzyme that converts testosterone into estrogen. Some users report a significant reduction in their COVID-19 symptoms. Those infected with the virus reported using quercetin with vitamin C, vitamin D, and zinc. Their breathing was easier, and this combination helped them to recover faster, and this is beginning to be backed by clinical studies. Many using the quercetin report a dramatic improvement in seasonal allergy symptoms also. Others claim that quercetin helps to reduce muscle soreness after a workout, and arthritis pain is also reduced. Many people say using quercetin consistently reduced their cold symptoms faster. Some who are suffering from allergies say that quercetin is a great alternative to antihistamines without the drowsy side effects that's caused by these drugs. Overall, quercetin users say they're able to breathe easier, experience less pain, and have more power and stamina. A double-blind, placebo-controlled clinical trial was conducted in 2013 in Iran with 26 badminton players. One group was given quercetin at 1,000 milligrams per day for 8 weeks, and the control group was given a placebo. The aim of the study was to determine how quercetin supplementation affects performance, muscle damage, and body muscle in the badminton players. Lactate concentration, body fat percentage, and VO2 max did not show any significant difference after the 8 weeks in either group, but there was a significant difference in the time to exhaustion in the quercetin group, but not in the placebo. The researchers concluded the intake of quercetin can improve endurance exercise performance, but may not reduce the body fat percentage. Several animal studies have been conducted to evaluate quercetin's effect on oxidative stress. In one study, oral quercetin, up to 50 milligrams per kg, was shown to protect rodents from oxidative stress and disorders associated with it. Quercetin also protects against the neurotoxicity of several heavy metals. 3 animal studies were conducted on the impact of quercetin toxicity induced by lead, metal mercury, and tungsten. The results indicate that quercetin functioned as an effective protector against metal-induced neurotoxins, and it could be considered a potent therapeutic intervention to cure cognitive deficits induced by these metals. High-fat diets cause oxidative stress, which can lead to neurodegenerative disease. In one study, a test group of mice were fed high-fat diets and they were given quercetin. The scientists found the quercetin reduced the cognitive impairment that's induced by a high-fat diet. Quercetin has been shown to improve neuronal function recovery in rats who are affected with intracerebral hemorrhage by inhibiting inflammatory response and apoptosis and promoting nerve function restoration. Recent studies show that quercetin reduces the symptoms of Alzheimer's disease and other age-related cognitive disorders. Although the research is limited, The few studies that are present on quercetin's ability to reduce the symptoms of the novel coronavirus indicate it has a significant capability to interfere with the replication of the virus. Quercetin exhibits a wide range of antiviral properties which can intervene in every step from virus entry to replication to protein assembly. The impact of quercetin can be further enhanced through its co-administration of vitamin C, zinc, and shikimic acid. The recommended nootropic dose for quercetin is 500 mg up to twice per day. Quercetin doses of 1000 mg, and on the advice of your doctor up to 3000 mg per day, can reduce COVID-19 symptoms. Note this is for short-term use at the high doses. The daily intake of quercetin from food in a typical Western diet is estimated to be up to 30 mg per day. Quercetin as a supplement has low bioavailability because it doesn't easily cross the intestinal wall. Poor bioavailability is why many quercetin supplements include other compounds like vitamin C, bromelain, or other digestive enzymes to help to boost the absorption. A more recent development shows increased absorption of quercetin when it's attached to a phospholipid complex made from lecithin called a phytosome. Quercetin phytosome has been shown to be 20 times more bioavailable than quercetin on its own. Research also shows quercetin has a synergistic effect when it's combined with other flavonoid supplements like resveratrol, genistein, and catechins. Quercetin is non-toxic and is considered well tolerated and safe when used at the recommended doses. Supplementing with more than 1000 mg of quercetin per day can lead to symptoms like stomach aches, headaches, and tingling sensations. Talk to a doctor before supplementing if you're pregnant or breastfeeding. Quercetin inhibits aromatase, so if you're being treated for breast cancer, talk to a doctor before taking quercetin. Animal studies show high doses of quercetin can have negative effects on sperm quality and sperm count in males, but only when coupled with elevated oxidative stress. Quercetin can also thin the blood, so it may interfere or amplify the effects of blood thinning medication, and there's some evidence that quercetin could interfere with transplant anti-rejection drugs. There's no clinical proof that quercetin is safe to use for longer than 12 weeks. The safety of long-term quercetin is still unknown. Quercetin is especially helpful for people suffering from allergies, arthritis pain, muscle soreness, or a workout or a cold. Quercetin seems to be effective according to a new clinical study and several user reports for reducing the severity and the symptoms associated with COVID-19. Anecdotal evidence of using quercetin to reduce the COVID-19 symptoms requires doses of 1000 to 3000 mg per day until the symptoms are gone. Quercetin is non-toxic and is considered well tolerated and safe when used at recommended doses. Since quercetin in its pure form is not easily absorbed by the digestive system, choose a quercetin supplement combined with bromelain, vitamin C, or quercetin phytosome. As a nootropic, it seems to be effective, starting at doses of 500 mg per day. Doses above 1000 mg per day are not recommended for long-term use unless prescribed by a doctor. For more information about herbs, supplements, and natural treatment plans, check out my website.